My name is Karlee Peyton, and I am going to be presenting the pros or the advantages to DIR/Floortime. DIR stands for Developmental Individual Difference and Relationship. DIR is the framework to help the people involved in the child's life, such as clinicians in speech-language pathology, occupational therapy, and physical therapy, family members, primary caretakers, and educators. This team helps to facilitate a comprehensive assessment and create a plan to best suit both the child's strengths and weaknesses. DIR Floortime has the ability as a therapy technique to help take the child through the different stages of socializing. To appropriately socialize, one needs to be able to master homeostasis, attachment, somatopsychological differentiation, behavioral organization, initiative and internalization, representational capacity differentiation, and consolidation. DIR was first discovered as a prominent practice in 1997 when Dr. Stanley Greenspan and Dr. Serena Wielder saw evidence as to how much growth a person can make when the therapy was implemented. In 2000, the study and framework of Greenspan and Wielder was published. After Greenspan and Wielder's study was published, family physicians started to study the interaction between a mother and her child, especially in the cases of an at-risk infant. From the time of the study on, doctors watched this population carefully to see if less interaction correlated with attachment problems. What is the difference between DIR and DIR Floortime? DIR is the comprehensive or overall framework to the therapy intervention. Usually, implementing the DIR takes a team to create and carry out the therapy. DIR can include floor time into the plan, but it also incorporates a variety of other problem-solving exercises. While DIR as a whole heavily emphasizes the role of the parents, family, or caretakers to be the emotional support for the child, Floortime has more of the play portion under the umbrella term DIR. Floortime incorporates the child's lead into play-based environment. The client's conversation partner, whether it be a parent or educator, is to join into their world at their developmental capacity instead of their chronological age, so as to match where the client is at in their socializing skills. The conversation is not only following the child's lead in play, but also to follow in their social and emotional interests. The conversation partner should also challenge them towards mastering social, emotional, and intellectual capacities through their way of play. The biggest mistake when thinking of DIR Floortime is that there is no limit on how old a person is when DIR is implemented. A good majority of the population that utilizes this model are professionals working with children. However, if the social, emotional, and play skills of the person is that of a child, it will still benefit them to work on the skills at this level. For some, this could be a lifetime model to work with. Another common belief is that this theory is not research-based, but instead is just simply playing with the child. However, there has been multiple evidence-based practices along with research to help provide the information to back up the claimed improvements made when implementing DIR and DIR Floortime. The intervention is plausible by the means that it incorporates both the logical or cognitive growth within the child, as well as focusing on the early development. DIR is based on a relationship-based component, which in turn will benefit the client in all aspects of life of the intervention. Parent interaction within the intervention can be considered both a positive and a negative. In some cases, the parent or caretaker may feel like they are inadequate to give the therapy to the client. They feel as though they are lost in what they are doing and that a professional such as a speech-language pathologist or an occupational therapist would do a much better job. The parent and/or caretaker may also believe that their interactions are not helping the client in the way that they are expecting. What the parent does not realize is that how the increased interactions with someone who they are familiar with will impact their future in all aspects, such as spontaneous play, questions, and interactions. A child-parent interaction with sensory activities creates nerve cell networks and neural pathways in the development of the child's brain. During this exchange of play interactions, there is an ongoing loop of sensory motor transformations seen within the child. Parents also may struggle with how to play with someone who is not interested in playing. The team oversees the DIR implementation and will help through coaching the parent or caretaker as to how they can model or imitate to keep the child engaged. An example of this would be to imitate the child's arms flailing movements and then make it into a game of patty cake. DIR is not just a therapy for socializing, as some may think. Although it is geared toward the autism population, it is made for anyone who is missing the first milestones in conversation, socializing, cognition, and overall development behind. The intervention takes individual differences into account as each person has different qualities and has a unique way which they respond. regulate, and handle their sensory stimulation and planner sequence. Although DIR was not intended for the autism population specifically, research has shown that it is an effective means to improve on their socializing, empathizing, and play skills. The therapy is recognized as a multiple pathway model to recognize multiple factors within the autism spectrum disorder, or in any disorder for that matter. ABA has started to incorporate aspects of DIR Floortime into their behavioral methods. It has also been used as an alternative to less effective behavioral methods in ABA. Along with DIR Floortime being used in other methods, it is used in almost every country and across the United States. A particular intervention program that stemmed from DIR Floortime was a PLAY project, which stands for Play and Language for Autistic Youngsters. It is research-based and has significant positive outcomes since 2014. This intervention in particular has an organization that provides professional training and development to those who want to go in and help coach the parents or caretakers of those with autism. Like DIR, the play model works on the child's lead, helps to build a good connection between the parent and child or client and caretaker, and give a high-intensity level of intervention. This is just one option that incorporates the DIR Floortime model into their therapy. As it can be interpreted different ways, this is an example of an organization taking this model to a specific population. DIR Floortime is not perfect, and flaws can be found within the treatment, such as making the parents feel inadequate when trying to implement the therapy, trying to limit this treatment to a specific age group, or becoming too population-specific. Although these all may be true in some cases, for the majority of the cases, this model is strong in research and has a strong evidence-based positive outcome. One, all people who may be developmentally, socially, or emotionally behind. Greenspan and Wielder created this model to help improve a person's people skills to help them advance in life through a natural environment. By using the DIR Floortime model, a client is achieving just that. With the implementation of this specific model, the DIR team hopes, or rather expects, what a client is using in a comfortable environment with a person at their level, both physically, developmentally, and cognitively, that it will transfer into an everyday change for the better of the client.